Hello, and welcome to our presentation on the pathophysiology of psoriasis. We hope you enjoy. Now let's get ready to learn. We know you have a bunch of questions regarding psoriasis, and hopefully throughout the course of this presentation we will be able to answer most of your questions. And if we don't, please comment below. But most important, the main focus, let's learn about psoriasis. So what is psoriasis, you ask? Psoriasis is a genetic disorder that has the potential to trigger an autoimmune response where T cells react to certain antigens, resulting in inflamed, red, patchy skin. Now let's talk about the pathophysiology behind psoriasis. In an individual who does not have psoriasis, the normal immune system relies on T cells in the bloodstream to aid in the recognition and destruction of foreign substances. When an individual has a genetic predisposition to psoriasis, an autoimmune inflammatory response can be activated by certain environmental agents, prolonged psychological stress, consumption of certain medications, and presence of infections. As a result, a thick red rash appears on the skin. Individuals who live in colder climates have a greater chance of initiating their genetic predisposition. As individuals age, their chances of developing psoriasis increases. Psoriasis affects 2 to 3% of the world population and less than 5% of people living here in the United States. Psoriasis is most commonly seen as thick red patches of skin covered with silvery dead skin scales. The rash may be present all over the body, but is most common on the elbows, knees, and scalp. Most patients experience itching and burning sensations on areas covered by the rash. Other body parts may be affected as well. While yes, there are multiple forms of psoriasis. The most common seen form of the disease is plaque psoriasis. Plaque psoriasis is a buildup of dead skin cell layers that are typically present on the scalp, knees, elbows, and lower back. Guttate psoriasis presents itself as small dot-like lesions on the skin. This type begins in childhood and can remain present throughout life. A strep infection typically triggers guttate psoriasis. Inverse psoriasis is seen under skin folds such as behind the knee and groin. This type is known to have very red lesions that are seen simultaneously with other types of psoriasis. Pustular psoriasis is most common on the hands and feet and is characterized by red skin containing white pustules filled with white blood cells. The most severe type of psoriasis is known as erythrodermic psoriasis. This type is typically seen as widespread redness that causes itching and burning sensations. The dead skin buildup may peel off in sheets and cause pain. Erythrodermic psoriasis is commonly seen in conjunction with plaque psoriasis. Although there are many forms of psoriasis, generally psoriasis is diagnosed by the appearance of the skin. Dermatologists look for thick red patches of skin that are covered by silver dead skin scales. The most indicative symptom of psoriasis is bleeding when the scales are peeled off. This symptom is known as the Auspitz sign. Treatments are dependent on the severity, age of the patient, ability of the patient to deal with the side effects of the disease, and type present. Common treatments consist of topical agents, emollients, coal tar agents, and steroids. Medications are also used to treat most forms of the disease. Please feel free to pause the video in order to get a good look at the pictures provided on the next few slides. At this time, please pause the presentation and take your time reading and answering the question regarding what you have just learned on psoriasis. Thank you so much for taking the time to watch our presentation on psoriasis. We hope you have learned something new. Have a wonderful day.
Created using Powtoon.